On this Wednesday morning. So of course, globally, about 1 in 4 adults will have a stroke within their lifetime. And that's why today on World Stroke Day, we are taking time to really learn a lot more about the risks and signs of a stroke. So we have Dr. Joseph Laporta from UC Health in studio, kind of breaking down the background in simplistic terms of neurology and what to watch out for, because I know as we get older, I'm sure it gets tied into lifestyle and hereditary concerns. But what do we watch out for as far as stroke goes? Because anyone really can have a stroke.
Yeah, certainly, and I think it's so important, and I'm so glad that we have World Stroke Day and things to raise awareness. The remarkable thing about stroke is the faster that you recognize it, the faster you treat it. There are truly miraculous treatments now in stroke where we can have people who come in paralyzed, unable to speak, and return completely to normal, but we can only do that if they reach the hospital very quickly. The biggest things we look for, so there's this acronym we can see here, FAST, that the American Heart Association developed. FAST, the acronym F for face. We talk about people often with stroke come in with facial droop. A is arm weakness. People often will have one-sided arm or leg weakness.
Sure.
S is speech, where they can have difficulty getting the words out. They can have slurring of speech or inability to understand what's going on. And then T just refers to time to call 911. Again, it's so imperative that if you recognize this or if a loved one has this and you see it, you call 911. We hear a lot of really sad cases of people who say, hey, I suddenly, my face was drooping, I couldn't use my arm, I decided to sleep it off, and if it was still there in the morning, I would come to the hospital, and by that time it's too late. We can't always help people.
Yeah.
Really, the sooner we can get in there, the sooner we can change outcomes and have people return to normal life sometimes.
Well, and they say, sometimes I've heard in the medical community, time equals brain.
100%.
And I know that sounds kind of weird to say, but think about it again, time equals brain, because you have millions of cells in your brain that die when they're starved of oxygen or blood or whatever it may be, right?
Exactly. So in a lot of strokes, the most common types of strokes are clots blocking blood vessels, preventing the brain from getting oxygen. And millions of neurons die every minute that they lose oxygen. And the challenging thing with the brain compared to a lot of other injuries is that the brain, its ability to heal as compared to something like the skin or bones is so limited. And that's why a lot of neurologic injuries are permanent unless we can treat them.
Now, I talked too at the beginning of the interview about environment. I mean, you have to take care of yourself too. That's a component of this as well.
Yeah, so we can do a lot as neurologists of reversing strokes, of preventing future strokes, but the biggest thing we can do is just prevent the strokes in the first place.
Sure.
And so there's so many things that are prevalent in our patients, prevalent in the world, in America. We talk about things like obesity, diabetes, high cholesterol, high blood pressure, certainly smoking, and then a under-recognized aspect is untreated sleep apnea. These are all common causes of stroke.
Yeah.
And the goal is, as neurologists, we don't want to ever see strokes. If people are working on these risk factors and working with maybe their primary care physicians to manage this, their risk of having a stroke becomes very limited.
Yeah, it's good stuff. It's good advice, and we try to do as much education as we possibly can on it. But remember, FAST right behind us, and if you see that or feel that yourself, get to a doctor immediately. Thank you, Doc.
Absolutely.
Appreciate your time. That information on the website, fox19.com. We'll be right back.